The sense of the circles is that I work with trauma, trauma survivors and so on. And so I'm aware of a kind of a balance that I need to maintain in order to be authentically present to the encounter. And the way I intuit it is that when the person sits there, they're sitting there with me kind of encircled in their suffering. That is, they experience their life as being circumscribed by their difficulties. And some of it's pretty painful stuff, really painful stuff. It isn't just what was done to them, it's what was done to them did to them. And issues around shame, issues around hopelessness, issues around being flooded, all of that. So then I experience that I'm sitting in my circle, and our circles are touching each other. So I am aware that if I'm not willing to step into the circle with them, they will intuit that they're alone. That is, I will be sitting there protected by this thing. I'll be listening, but I won't be with them in their difficulties. So in that sense, I have to step into the circle. But if I put both feet into the circle, then there's the risk that I'll get flooded and overwhelmed. And the risk of the trauma survivor is the risk of destroying the helper. That is, my suffering is so deep that if you get too close to me, I'll bring you down. That I kind of owe it to you, like warning. Don't get too close to me, because this is too much. And so I owe it to myself and to them. Otherwise, I can't do the work. To maintain a way of staying grounded in that which infinitely transcends the intensity of their difficulties, which is my presence, which is the miracle of our presence together in the room. So I have to lean back, I have to keep one foot in the circle of being present, put the other foot in their circle, and maintain that stance. Now, if in that stance I'm monitoring that, because if in that stance I find myself getting too detached, for example, I'm kind of taken by the brilliance of my next intervention. Like I got a deep insight, wait till they hear this, or I think I got it all kind of, I can feel myself intellectualizing the process and stepping back. But if I lean in too close, where my own countertransference, my own thing, I'm getting triggered, I'm starting to get a little flooded, and I realize that it'll get in the way of why we're there. And therefore, if I get too close, I have to lean back into the foot outside the circle. I get too detached, I have to lean into the circle. And as I do that, I can become a conduit through which presence flows through me into them. Now, as it flows through me into them, they discover that what they experience first coming through me, see, they attribute it to me. Like they're grateful to me for being present, being patient, they attribute it to me. As they get more into it, they attribute it to what happens when we're together. See, in the together, they know something happens in here when we talk like this. As it gets a little further and they get closer, they realize it's within themselves. And once they discover it's within themselves, then they discover they're to do intrapersonally what we've learned to do interpersonally. If they lean in too far, they'll get flooded. If they lean back too far, they'll never engage it. So they always have to stay in the kind of the comfort of discomfort by being grounded enough to have self-efficacy by touching the hurting place.
Yeah.
And then if it gets too much, they back off, they integrate what happened, they touch it again. And that art form, I think, builds character. You know what I mean? It gives them confidence. And that's a huge part of what a lot of psychological healing is about. A lot of it has to do is they can't find their footing in their own experience. And so in the interpersonal dance of that kind of balance, they interpersonally maintain that stance. And they start to get more grounded in their own life.
So it's the healing therapeutic dance between two people.
It really is. So if we, like Thich Nhat Hanh says, if we inter-are with each other, we are, but we inter-are. And in the way that we inter-are, we internalize it in the self's relationship with itself. Because that's what they're coming in with. It's true they have, and that their difficulty in the relationship with themselves gets played out in the relationship with others, because we tend to treat others the way we treat ourselves. And so it works from the inside out. As they get more grounded, then you can start looking at the systems dimension of this. Like what's going on? How's this get played out at home? And how could they be more authentically present to the people? It spreads out like that.